Good evening and welcome to I'm Listening Live. I'm Listening is a 24/7, 365 initiative that works to destigmatize mental health, but also let everyone know that we are listening and we're here. Now, the holidays are coming. We are in holiday season, and I know a lot of people are worried about what the holidays are going to look like. So I am lovingly reminding everyone that we are still in the middle of a pandemic. In fact, numbers are skyrocketing. So now more than ever, we have to take things seriously. And that means making sure that we are staying home for the holidays. We can return to having them the way we used to next year, but this year, please, please stay home and do it differently. Now, having the holidays different doesn't mean that it's bad. It doesn't mean that it's canceled. And I'm telling people in my practice, some people want to just kind of let it slip by. That's cool. But for those that still want to honor it in some way, you can still have all the food you're used to having. You can still decorate, play the music, watch the movies, and dress up. But it definitely has to be different this year. And I also want to remind everyone that there's a lot of people right now struggling with depression, isolation. So please check in on people. You don't know how meaningful it can be to just send someone a text, letting them know that you're thinking about them or giving them a quick phone call. So please check in on those that you haven't heard from and those you care about. And now let's go to our first guest, Dr. James Q Simmons. Welcome to the show.
Why, thank you, Dr. Chris.
Good to have you back.
Good, thank you. I'm happy to be here. It's been a little while.
It has. How are you hanging in there? How's your mental health through all this?
Very interestingly, it's tenuous at times, not gonna lie. But today, I'm doing well. I actually took did a lot of self-care over the weekend that I always tell other people to do. And I finally decided to listen to myself, and I actually feel a lot better.
And it's amazing how it works when you take your own advice, right?
It also in healthcare and everything. I have a torn bicep right now.
Oh man.
Have I done all of the things I need to be doing to get torn bicep? No, of course not. I'm like, oh yeah, I can lift that box. It's fine. So very much sometimes a do what I say, not as I do thing.
Bless it, man. I'm taking my own advice. So I've been focusing on so much rest. That's just been like the mantra, rest. But vaccines. So, again, COVID, right now the numbers are ridiculously high. I, for the first time, have started to get anxiety. I think everything got a little normalized. I've definitely been following the rules, isolating, wearing my mask. But look at the numbers. It's quite scary. So talk to us a little bit about that. And then also, what can we expect in terms of vaccines?
I think, Chris, you're not alone. Everyone got a little lax, and we see it in the numbers, right? The data, however you say it, doesn't lie. And, for better or for worse, now we are, I hate to use this word. I really don't like this word at all. I think you've talked about this before, but there are consequences for our actions, right? That's a really intense word. But I think a lack of, federal response to this early on and continued, states lagging behind and really just doing the simple things and following some of the science has led us here. And, we've led us to this really, really great point now where we have this amazing information about vaccines, right? And all this awesome news has come out about vaccines, but we're still months and months and months away from those vaccines getting out to everyone and becoming, normal. And so now we have to still do the things that a lot of folks haven't really been doing for months if we're going to slow this thing down at all.
Yeah, I've been saying it to nauseum. The holidays are coming. They're going to be different this year. Please, please, please stay home. Different doesn't mean bad or canceled or wrong. Just got to, get a little more creative. Yeah, exactly.
Serious. The different doesn't mean bad. I'm having this same conversation with my family right now and my partner's family, that it's uncomfortable. We don't, you know better than anyone, Chris. We as human beings inherently don't like change. We're like, that's weird, that's different, I'm not sure I'm a fan of this thing whatsoever. It doesn't feel like that feeling that I'm used to, that I've been looking forward to, especially in a year like this one where we haven't really had a lot to look forward to, right? And so now we come up to these holidays and it's kind of a mess, but I just keep telling people it is okay for these holidays to feel different so that we're all around to go back to the way holidays used to be next year.
Yeah, I saw a press conference with the governor of New Jersey, and it was so powerful. They were saying, come on, masks, they're annoying, they get in the way. And the governor was like, you know what's annoying? Death. And I was like, and there it is. And there it is. It's literally a life-saving mechanism. Put it on your face and stay home. But as far as vaccines, I'm doing telemedicine only. And I have clients that are really eager to get back in my office. And my hard line's been, as soon as there's a vaccine, I welcome you all back in. But until then, I don't feel that there's enough precautions we can take to promise that I'm going to be able to keep myself and all the patients in my practice safe. What are we looking at? Are we looking at March? Somehow March keeps being where people are saying it might be available to the wider public.
Yeah, we like that time frame, at least at this point. Although the most recent vaccine news coming out of Pfizer and Moderna was actually a lot better than we thought it was going to be. So some experts are saying that timeline could even be a little bit faster. So for those of you watching, listening, who may not know, there's 2 vaccine announcements. Pfizer has announced that they have a vaccine that they think is about 90% effective. Moderna is saying 94.5% effective. They had very similar studies. Both of them had large groups of individuals. So Moderna had 30,000, Pfizer had 44,000. They gave half of the people placebo, the other half their vaccine. And then they sent them out into the world for about 3 months and said, all right, we're just going to track and see who gets COVID and then come back and look at the information. Well, in the Pfizer group, there were about 90 people who got COVID over that 3-month span in the Pfizer group, about 95 in the Moderna group. Only 5 from the Moderna group that got the vaccine were the people who got COVID, meaning 85 of the people were the ones who got the placebo, which is how they get to the 94.5% effective. That is way more than the 50 to 60% effective that we thought this was going to be. Now, a couple of caveats here. We don't have the intense, really juicy, yummy data for all of us to look at and sort of dissect. These were both announced just by press releases, right? And the presidents of both of the pharmaceutical companies saying, look at our vaccine, it's super great. But even folks like Dr. Anthony Fauci and some of the others at the NIH who have partially funded these studies are saying, this looks very, very promising. We might be able to move into that logistics phase of a vaccine much, much faster than we thought.
Beautiful. And quickly before we let you go, just talk briefly about the safety of vaccines, because that's also something that's coming up where people are saying, do you really believe that they're effective? Is it a controversy? What's going on behind the doors? So what are your thoughts on vaccines in general?
There have been vaccine controversies since we started doing vaccines, right? So for 150 years or so, this is not new, this controversy around this. The numbers of Americans who are actually willing to take the vaccine, Chris, is actually creeping up a little bit. So it was a little bit below 50%. It's now a little bit over 50%. I will tell folks watching, listen, we are very good at vaccines. This is not like this is the first time we've ever created a vaccine and we don't know what we're doing. The technology with this vaccine is a little bit new, but coronaviruses in general are not new to scientific research. Developing vaccines are not new. We don't generally do it this fast, but there's also so many eyes and ears and checks and balances in place that we're really, really harping on the safety of these vaccines because we've never tried to pull something off like this in humanity ever, that the scientists absolutely don't want to get it wrong. So we definitely need to see the data. We definitely need to be reassured that safety has been followed and that these are going to be safe. But I also think at the same time, there's potential for these to be extremely safe. And so far in early data, no real adverse effects from either vaccine, Pfizer or Moderna. So that's great news.
Awesome. Dr. James Q Simmons, thank you so much for being a part of our show.
Absolutely. My pleasure, Chris.
All right, y'all, we are still in a pandemic. The vaccine is not ready, so please still follow the guidelines, 6 feet apart, spending time only outdoors, not around crowds of people, and keep on those masks. All right, now we're going to go to our next guest, Nikki DeLoach. How are you? Welcome to the show.
Thank you so much for having me. I am doing well.
Good.
It's a good day by day, right?
I love hearing that. I love hearing that. So it's a mental health focused show. So I always start by asking guests, how is your mental health doing right now through all of this?
My mental health is it's good. Just to jump on in, why not? I have a 3-year-old who was born with congenital heart defects and has had 3 heart surgeries. So we've been living some semblance of this life for some time now. I mean, not quite to this, measure, but it's been very insular. So I had to learn very quickly how to do this, to be inside of this, to be inside of stress, to be inside of the everyday fear of something attacking your health. And I said in the beginning of COVID, at the beginning of the year, I kept telling people, this is a mental health marathon. Please take care of your mental health. And I knew it just from experience. So I've managed to be able to stay pretty mentally healthy throughout this. How about you?
I'm doing my best. I'm literally trying to walk my walk and talk my talk. Everything I'm talking to my patients about in my practice, because everything's, telemedicine right now. I'm trying to do it as well, because I used to rely on a lot of socialization, I've come to realize. And so now having to do it technologically, it's been a little bit different, but I'm glad we have the technology we have.
Oh, yeah. I mean, I certainly miss my friends. I miss being in communion with people big time. But I find that, the whole thing for me is to stay away from the future tripping, is what I call it. Like the future, just thinking about what's going to happen in 2 months or 6 months, or, just if we can wake up and say, this is what's on the agenda today. This is what I'm doing today. And if you can try and stay in that as much as possible, I found that it really serves me very well.
So beautifully said, because I think we all expected the pandemic to have wound down by now, and it just keeps getting pushed further and further, and we're not really sure when this is going to stop. So yeah, stay in the moment. Stay in the moment. Yeah,
you have to. I mean, I think for me, I thought that after Benny's first heart surgery that we would be done for a while. They were like, we won't need another one until 5, except for a year later, we were back in surgery. And then 6 months after that, we were back in surgery. And I had to learn that really hard lesson of, which we're all learning collectively right now, is that just because we want something to be over doesn't mean it's going to be over. And we have to continue to just practice our presence and just staying in the moment as much as possible, because we don't know what life is going to look like in 2 weeks. We don't know what it's going to look like in 2 months or 6 months, right? And it could actually look better than we think it does. And staying out of that mindset of the gloom and doom and everything is going to be horrible. By staying in the present, it keeps you out of that mindset of future tripping and thinking that like it's going to be bad forever. This too shall pass, and it will pass. It will not be like this forever.
And talking about other forms of self-care, because I think that's a really beautiful way to reframe everything. What forms of self-care have you found yourself relying upon to get through this time?
I have to say that I was horrible with self-care for the majority of my life. I mean, no sleep, forgot to eat, exercised a lot. I mean, I was an actor who had to be on television. So, it was very unhealthy. And then I got the news about my son, Bennett, who was in my belly. And I found out in the same week that my dad was diagnosed. He was 62 years old with Pick's disease, which is a very rare and aggressive form of dementia. And it changed everything for me in terms of how I take care of myself. And if you don't like self-care, you can call it soul care, if it helps you to maybe change the language of it up a little bit. But what I have learned is that if I go down, the whole family goes down. Nobody works if I'm not working. Wow. And so if I don't get my sleep, and if I don't take care of my being, and that means not just my physical self, but my mental self, my emotional self, my spiritual self, if I don't protect that, and sometimes you have to be really aggressive and vigilant, even if it's 10 minutes. Yesterday, I took 10 minutes, I sat outside in the sun, and I just ate my food. And I did nothing else but that. And I just took my 10 minutes and I went for a walk later in the day. That's all I did. But you know what? A little bit goes a long way.
Exactly. And that's one of the things I'm saying, when I'm working with my clients, I'm saying, have you gotten outside today? Have you gotten any sunlight? And like you said, 10 minutes can be one of the most recharging, grounding things ever, right?
Vitamin D.
But I'm glad you didn't mention baking, because that's been the bane of my time right now. Everyone I'm asking, they're like, I'm baking and I'm baking bread. And I'm like, I refuse. I'm not doing the baking.
Yeah, because I'll eat all of it.
That's part of it. And I just don't enjoy cooking.
No, neither does my husband, by the way. He hates to touch food in any sort of capacity. So, and by the way, another thing that I did this week, I ordered food that was already prepared. And we are having that for dinner this week because I knew I had a really big week. I knew I was working a ton, and I didn't want to stress about that. I have cooked 12,000 meals since the beginning of this. And
no one's counting.
Yeah. I just said, I'm not doing it. I'm ordering food. We are going to eat. Somebody else is going to cook. And this is what we're going to have this week. And I'm going to take the time that I would be cooking in the kitchen for an hour and a half. And I'm going to go and I'm going to spend that with my kids instead. So those are things that you can do. And I know it sounds so small, but those little things really add up.
So let's talk quickly about the holidays. The holidays are coming. There's a lot of people that are going to be maybe isolated, celebrating them by themselves. And one of the things I'm trying to tell everyone with the radio show and in my practice is it just has to be different this year, right? We can still celebrate and dress up. And so I wanted to ask you, how are you going to be spending the holidays? And also, thank you for the Hallmark channel and everything you're doing there, because I think that is very much a center point for a lot of people's holidays. And I think it's going to be one of those things that are going to make people still feel like they're participating somehow.
Thank you so much for bringing that up. I appreciate it. Hallmark, I'm so blessed to be a part of a network that puts content out there that just makes people happy. It just makes people happy. And I wanted to be a part of making content that brings joy to people for a very long time. And the fact that I get to do that on Hallmark makes me, it's such a gift. And people always come up and are like, thank you. And I'm like, no, thank you. Thank you for watching. But it is going to be harder, and it is going to, it is going to be different. I won't say that it's going to be harder because, there's a lot of things in my life that I thought, especially in the last 3 years, with everything that I've gone through with Bennett and my dad, that I thought, oh, this is going to be really a lot harder, meaning not being able to get back to Georgia for Christmas. We weren't able to do that for a while because we couldn't travel with my son. And it ended up being so incredible. And of course I missed my family, but we did things here together as our family that we had never done before. And we put traditions in place that we had never done before. And it ended up being an amazing Christmas. And so I would invite everyone to think of it. Go ahead and get your mind on the fact that it's going to be different and stay very open. Just pull that heart open. Pull your mind open and just allow, right? Just allow, because what I've learned is if you can stay open inside of anything, no matter how painful, that's where the miracles and the magic happen. That's where the surprises come in. That's where the delight happens, the things that you didn't expect, One example I'll say is I'm a big spokesperson for the Alzheimer's Association, and I always am a part of the team that leads the walk to end Alzheimer's in Los Angeles. And this year, obviously, it was very different. It was virtual. And I woke up that morning. Actually, the election was called that morning. So I started my walk a little bit later because I was like, wait, what's going on? And I had one friend that came and joined me, masked. She walked with me at a distance. And I had woken up that morning. I just said, Nikki, just stay open, just stay open, just stay open. And we walked. I walked my dog. She walked with me at a distance. And we walked outside. And there were 2 giant double rainbows all over the entire city of Los Angeles. The air was crisp. It was so beautiful outside. I felt all of these people that were walking from all parts of the country with me. And it was one of the most, of course, I'm going to be so excited when we get to all be together again and walk together again. But I will never forget that Saturday and that walk and how special and beautiful it was. And it was different, but it was also incredible. So just stay open.
Wow, I felt that whole story in my body. Thank you for that. It's going to be different, but hold space for it still being special. Nikki DeLoach, thank you so much for being part of the show.
Thank you so much for having me, and thank you for what you do.
Thank you.
It's so important. I believe that not enough people get access to mental health care, and it's so necessary and it is so needed. It doesn't matter what age you are, the color of your skin, how much money you make, everybody needs access to good mental health care. So thank you so much for
thank you.
Have a great night.
Yeah, you too. And Merry Christmas.
Merry Christmas. Bye-bye. And there it is, folks. Look, things are going to be different this year, but that doesn't mean they have to be bad. And I love that concept. Holding space for the possibility of things being maybe more magical, more special than you expected, or even maybe better than it had been in the past. For those that need a little extra support, we're going to put some resources up at the end of the show. And you can check out past episodes of I'm Listening Live on all the radio.com handles. Thanks for hanging out with me, and you all have a beautiful, beautiful rest of your night.